welcome to our World Zoonosis Day webinar. Today we are commemorating a pivotal moment in the history of medicine. It was on a day like this that a French biologist in person of Louis Pasteur on July 6th, 1885, discovered and administered the first rabies vaccine. So as we gather today, we recognize the significance of zoonotic diseases and their impact on human and animal health, on our economies and livelihoods. So we also acknowledge the importance of a One Health approach in preventing and managing these diseases as well. So in this webinar today, we'll be learning on zoonotic diseases, progress, control, and the elimination. So today we have a fantastic speaker. And before we have her, we would love to firstly read out our biography so that we can all get to know her. After which you are going to be seeing a very short video produced by the Faith Connect team. It's inspired by the 2024 World Zoonosis Day. So I would like to invite my fellow moderator in person of Vivian to take the biography of our speaker this morning. So Vivian.
Okay. I'll go ahead. I'll straight away. So this is the biography of Dr. Yetunde Abioye. Dr. Yetunde Abioye is a veterinarian working with transboundary fields across the human-animal interface. Currently, she works with the Nigeria Center for Disease Control and Prevention, that's NCDC, as an epidemiologist and One Health officer. Additionally, she coordinates the preparedness, readiness, and response strategies in the control and management of Lassa fever as the Nigerian National Incident Manager of the Technical Working Group, that's TWG. Since she joined the One Health Division of the Surveillance and Epidemiology of the NCDC, she has supported implementation of the key activities in the National One Health Strategic Plan, that's NOHSP, and made presentations at international conferences and meetings. Additionally, she was appointed as a member of the African Union One Health Information Architecture, TWG, to guide digitized One Health governance and management in Africa. Despite protecting the health of Nigerians, she finds time to mentor a group of veterinarians through a mentoring platform. This is due to her tireless commitment to development initiatives for youth. So that's a short bio about the person we'll be having take us through this session today. So Gideon, over to you.
All right, thank you so much, Vivian. Dr. Yetunde, we are glad to have you, and thanks to everyone for joining this morning. So before we have Dr. Yetunde, I'd like us to quickly see this short video, and I believe you all have our writing materials prepared so that we can begin to take notes of the amazing things we're going to be learning today, and of course, to take note of our questions. So I will go straight forward to share my screen so that we can all see the short video. Can we all see my screen?
Yes, sir.
All right.
It's not good. It's infected. It's very good. No, it should not be sold to anybody.
See now, see.
No. It's still no good. Sam. See now, see. It should not be sold to people. I beg. You should take it away.
It's very good.
No, it's not.
Customer.
Yes.
Good morning, customer. Give me meat.
How much on?
The type the one you always give me.
Okay.
No.
Okay.
If you sell some other part, but not this particular one. This is not good. This is not
It's very good.
This is not food for human consumption.
Excuse me, what are you saying? This is the part I always buy. Please, customer, beg, give me meat. This is very low budget. Fit for this our economy. Please give me meat. Let me go.
No.
Where's that my money?
You should not eat this thing. Like this is not supposed to be sold to people. No.
Thank you so much, customer. Thank you.
No.
Give me meat, John.
Oga John.
My neighbor.
How you doing?
I know they fine.
Wetin happen?
That dog beat me.
Which of the dog?
That their obedience dog, they always beat on the collar.
You mean dog bite you?
I went out to get something now. I'm not even sure it's vaccinated. And the money I have is for something very important. I don't have money, extra money to pay for medical bills. See, this wound is very deep and painful.
Let's try herbal medicine.
It works.
It works.
Please help me.
It has worked for somebody.
Wow.
And the whole thing finished.
That's interesting.
Yes, this one is serious thing, no. But it go work.
Please help me.
Please, it's not far. Let me check on the person.
Okay, my neighbor.
I believe say it go work.
Thank you. I do it. This about preparation didn't work. Oh my god.
What's happening to
Rabies and tuberculosis are serious zoonotic diseases. For the interesting part is, they are both preventable. You should know that 60% of all human diseases and approximately 75% of emerging diseases are zoonotic. Please do not be like John that refused to access medical care and ended up dying, or Mama Nkechi that decided to save costs and landed herself a bigger problem. Health is wealth. Please prioritize yours today. Through Vet Connect, animal care is more accessible and available to ensure timely prevention and treatment by connecting you to healthcare professionals near you. Protect yourself and your animal. Wait no more. Download the Vet Connect app on Google Play Store or Apple Store.
All right, thank you so much for your patience. Right now, we are going to be having our speaker in person of Dr. Yetunde Abioye. So, Dr. Yetunde, we are glad to have you this morning. And I think at this point, I really have you to begin with us. Thank you so much, ma'am. So, Dr. Yetunde, over to you, ma'am.
Okay, good day, everyone. Please confirm that you can hear me and you can see my screen.
Yeah, we can hear you and see your screen.
You can see your screen.
Great. Thank you so much for joining this very important webinar. It's really a great pleasure to also work with colleagues from Vet Connect. Thank you so much, Dr. Shedrack, personally for the invitation. And just as we've seen in a lot of the videos, I'm even happy that we had that presentation shared before this presentation. So Vivian, please just keep an eye for me on the time. When it's like 10 minutes to the end of my allotted time, just kindly let me know so that I don't talk too much. So I was very glad that was played ahead of this. So we'll just get straight right into the presentation, which was a very good way of starting. So as introduced earlier, I'm Dr. Yetunde Abioye. I'm an epidemiologist and One Health expert. I work with Nigeria Centers for Disease Control and Prevention. So looking at the theme for this year's World Zoonosis Day, focused on zoonotic diseases, the progress, control, and elimination. Just starting with Louis Pasteur's quotes on the role of the infinitely small in nature is infinitely great. You know, how something very little could cause quite a lot of pain, and how also paying attention to those little gritties could also help prevent or make the world a better place. So as a bit background, generally we know that we interact with our environment day in, day out, whether it's you are in an urban setting or a rural setting, we're always interacting with nature, and in this process, we also interact with animals in the environments that we share with them. So whether it's domestically, you know, these animals, you could have them as companion animals. You could use them, you know, to farm as beasts of burden or even transport yourselves, right? Generally, whether you have a farm or you don't have a farm, you also use it as a source of meat and milk, right? And also eggs. And then we also use this for sports as well, polo, when we talk about polo. And then it could also serve as a source of education for people across the globes, you know, the safaris, when we also do research to also kind of target, you know, the next pandemic disease and all of that. So zoonotic diseases are caused by harmful germs, whether they are viruses, bacteria, parasites, or fungi. And the zoonotic diseases are actually, you know, gotten from animals. So you have where diseases are transmitted between humans and animals, and then from the root word, the origin, zoo meaning animals, and then nosis, disease. So globally, we have over 200 zoonotic diseases that cause, whether it's mild, moderate, or even serious illnesses, unfortunately, even deaths. Examples of these, like the one for which Louis Pasteur created a vaccine for rabies. You know, you have highly pathogenic avian influenza. It could be dengue, Ebola, Lassa fever, anthrax. Like even in Nigeria, where we had a reemergence of anthrax after a very long time. Babesiosis, cholera, so many diseases. So even animals that appear, you know, healthy sometimes could be carrying, you know, diseases like even typhoid fever caused by salmonella, or the Lassa fever. We know rats, you know, these rats that serve as reservoirs for this Lassa virus, they don't seem to be affected by it. In fact, from literature, you even see cases where these animals were, even when they were born, they already had, they were natally infected, yeah, already. So whether vertical or horizontal transmission through, you know, from the mother to the child. And so many of these we've seen in so many diseases, even like HIV as well. So looking at the global burden of diseases and just doing a bit of reflection, of course, most of these statistics are from WHO, and then some as well got from Kelly, who is also referencing WHO. So just like we've heard from the presentation as well, 60% of pathogens that are known to humans that affect us are actually of you know, zoonotic origin, that's originated from animals, and have now been have a kind of sustained human to human transmissions. So that's where we will now say, okay, this is actually a human pathogen, but the origin of that is from animals. Now, 75% of emerging human pathogens are also found to be of animal origin. So new diseases like even the COVID-19 SARS-CoV-2 virus also emerged from animals. So a lot of it, even the mpox, where we had the multi-strain, that's monkeypox, formerly monkeypox, where we had multi-country strain of that also from animals. Highly pathogenic avian influenza currently circulating amongst, multiple species, animal species, where it has been isolated in cow milk and all of that. See, it's also animal origin. So unfortunately, every year as well, we have billions of illnesses and millions of deaths that are due to diseases or infections arising from, animals. Pandemics, we've also responded to, giving examples of that. And unfortunately, with regards to food security, because not just these diseases sometimes not just affect humans, but also affects, the livelihood of people. It also affects animals as well. So approximately you have people going to bed hungry. And if you look at it in line of the Sustainable Development Goals, this is something that is very, very important. And globally, we also need, to add, even looking at the population now, expanding, and even to feed people as well that have been not looking at new births. You also need to increase the source of animal protein, and doing that, that a lot of zoonotic diseases are also affecting animals. Like when you have cases of highly pathogenic avian influenza, some of the measures you have to take is to also humanely call the animals or the farm, or even in places where they have more resources, you look at a 10-meter radius or even more, and all those animals, they'll conduct safe burials on them, humanely call them to prevent, it spilling over or affecting humans. And that's a huge loss to the economy. We also have issues around, yes, of course, animal production linked to animals. So this affects generally humans, animals, are infected. And we also have cases whereby we are having 2.5 billion human illnesses, just very relatable, and sometimes deaths as well, arising from zoonotic diseases. So this is something that is very, very serious. This is just a timeline I found from Rural 21. They had done like a 30 years review of, emerging zoonosis outbreaks. Zoonotic diseases are not new. Since time immemorial, we've had zoonotic diseases very much with us, because we also relate with animals. But just looking at like some of these have been mentioned in the last 30 years, and we could even still give recent examples. So you have bovine spondylosis encephalopathy that affects humans, animals. You have the Nympha, SARS, highly pathogenic avian influenza, Ebola, Zika, Marburg, so many other diseases as well. If you remember the bird flu outbreak as well in 2000, the early 2000s, quite notable. And of course, we can't forget COVID-19 pandemic. COVID-19 pandemic, where the whole world stood at a standstill. We still have very fresh memories of the lockdowns. It affected the economy. In fact, the whole world has not still recovered. The world has never remained the same after the pandemic. And even now, we have people that will be coming back from Hajj very soon, this weekend. And we are already on alert looking at the new strain of COVID-19 virus circulating as well in the Hajj ground in Mecca. And we have some Nigerians who also went on pilgrimage that will be coming back. And this is definitely a cause for concern. We need to be on alert for that. So this is just showing us that, we have these outbreaks. We can relate one-on-one to these aspects and different experiences we have had with regards to this. So looking at, of course, from the COVID-19 pandemic, and Winston Churchill once said, never let a good crisis go to waste. And relating that, COVID-19 shaped a lot. Even now, we're talking about changes around the global health security agenda. We're talking about issues around international health regulations, which Nigeria and many other countries are also a signatory to. There was a conference, the World Health Assembly, and a lot of changes that have happened. Even the joint external evaluation that we also use to evaluate the core competencies of countries around the world to be able to respond, better prepare, respond, detect diseases, some of which are zoonotic diseases. Origin was also took out a lot of recommendations from COVID-19 pandemic. Generally, the world has not remained the same. Of course, a lot of outbreaks in the past have also shaped histories of how we have been responding and preparing. But then looking at COVID-19, that was a very pivotal moment, and we have continued to learn from outbreaks of zoonotic diseases within our borders and around our borders. So generally, how do we get infections from animals to humans? It could be through direct contact. So if an animal is infected, it could be carrying this in its on its skin, body, fur. It could be carrying it through the saliva, blood, urine, feces, and somehow some people even also directly consume the meat of these animals, like maybe properly. So now when the meat is not properly prepared, that could then result in like a secondary infection. Looking at where animals also live and roam, even controlling outbreaks of highly pathogenic avian influenza. You also have to make sure that not just that you call the animals, but you have to also make sure that the environment is properly sanitized and beds are not restocked for at least 6 months on the farm. So looking at also how they spread, vector borne, even rats house a reservoir for Lassa fever, and having contact with these rats or rodents could lead to spread. It could be through a tick bite. It could be through mosquitoes or fleas. It could be also, yes, okay, I've spoken about the foodborne aspect, also eating contaminated food, whether preparing, the process of preparing this food, if you don't practice proper food safety practices or hand hygiene, you could also be infected and even infect people whom the food is prepared for. Issues around unpasteurized raw milk. I've been on a rural campaign in Mubi, Adamawa State, where we went to vaccinate animals for CBPP, and we're offered raw unpasteurized milk, and I was shocked, but this they just directly milk the animals and drink, not pasteurizing. So this is also a very good avenue or source for diseases to be transmitted. Undercooked meat or eggs, raw fruits or vegetables. So even if you're a vegetarian and you don't properly clean your fruits or vegetables, you can still get infected. So it's not just about eating meat or drinking milk or eating eggs. If you have a pet as well, you could also be infected with zoonotic disease. It could be waterborne. So whether you are drinking a contaminated water or water, even now we have this ongoing cholera outbreak in Nigeria, and the major source of it is in water. You could say, oh, I actually take bottled water, but there are bottled waters now that are also already contaminated. So we also need to be careful generally, and this is just to raise our consciousness and awareness. So this is just a kind of a brief way on how to general precautionary measures. Of course, there are specific requirements for certain diseases, but it's very important to practice regular hand hygiene at all times, whether it's before, during, or after. You prepare food, you are preparing food, just constantly. You go to the toilet, you go outside the house, just constantly. You could have hand sanitizers, or best get soap and running water, wash your hand properly. But in limited settings like that, you can use hand sanitizers in between. But then regular hand hygiene is almost as old as man, but we still have issues, not even just to the layman, but even healthcare workers are also victims of this. So now we're also talking about issues around even dengue fever in Nigeria, right? Just giving examples for even our colleagues who are not Nigerians that are on the call. But it's very, very important to prevent yourself from mosquito bites, ticks, fleas. Just prevent yourself. Like if you have a dog, make sure that regularly, I'm not going to mention any brand of drug at all, but make sure you regularly take them for checkups, make sure that you regularly also treat them against ticks and fleas, and that way you also protect yourself, right? So we should also learn how to handle food safely, whether we are preparing personally for ourselves, or we are food vendors or sellers, or we have an outlet, even places where we also sell food, meat generally. So it's very, very important. Let's be also aware of the zoonotic disease in our vicinities, in our areas, when we are also traveling. For those people who travel a lot, if you have children under 5 are very, very vulnerable. Elderly people, people with immunocompromised systems, of course, like the general public is at risk, but just trying to give examples. So when you leave your country and are going to a certain place, also take vaccines, like vaccines for yellow fever available. Ensure you get vaccinated. Like in Nigeria, we do that every 10 years. Once it's 10 years, because we know it's endemic here, take another vaccine. If you are traveling to places that you know are endemic for certain diseases, you can also take, like, for example, yellow fever vaccine shots. Avoid bites and scratches from animals, whether it's your pet or if you are a veterinarian or para-veterinarian. This could be an occupational hazard, and it's very important to also protect yourself. You work with wildlife animals as well. Stick to guidelines and regulations within this area. So I'll try and speed up, but just giving examples, a lot has been done. In the international health regulations is one, the global health security agenda. Now we have collaborations around human animal environment interface, where we have the quadripartite now, WHO, FAO, the World Organization for Animal Health, United Nations Environment Program. But I just want to speak specifically to zoonotic diseases now, looking at the global efforts around a One Health approach to also control zoonotic disease. So One Health is an approach that fosters collaboration amongst human, animal, environmental health sectors. It's not new, it's as old as man. If you're very familiar with Ubuntu, which is like Ubuntu leadership theory, it talks about I am because you are. And it's basically that's the principle on which One Health rests. So it's not new, it's almost as old as man. But then, of course, with time, and especially around languages, terminologies keep being formed from day to day. But it's as old as man, it's not new. But then it just kind of it's an approach that can be used across different fields. But then speaking around multi-sectors, multi-disciplines. So US CDC developed a tool, which is the One Health Zoonotic prioritization tool. And this process helps to bring representatives from human, animal, environmental health sectors to be able to prioritize zoonotic disease. Remember, as a country, we'll see, or even globally, we have over 200 zoonotic diseases till date and counting. And we're also talking about emerging and re-emerging diseases. But we know that in certain regions, certain diseases affect people there. And even within the region, like in West African region or in Africa, you then still talk about specifically to your own country now. As a country, we also had a list when we're doing our priority zoonotic workshop, the second one. We had over 56 diseases, but then we had to prioritize it down to 6. The previous list that we had in 2017 prioritized 10 zoonotic disease. So this process is very transparent. It incorporates equal input from all the sectors. And the main goal of this is using a multi-sectoral, multi-partner approach is to prioritize disease within the country of greatest concern, develop steps and actions to address these diseases. So using the case study of rabies, this is one of the diseases that is a priority. In fact, still remains the number one priority zoonotic disease in Nigeria. It was also number one in 2017. Then we reprioritized in 2022, and that makes it our second and still number one. You will be amazed that even since when Louis Pasteur in the 18th centuries have been working on this, and even when a vaccine was developed for this, still this remains a challenge globally, and especially within Africa and Asia. The issues around One Health coordination and planning. Yes, we know the approach, we can say the definition, but in practice it's a problem. So of course we know that 99% of rabies, human rabies, is dog mediated. So the approach is mainly looking around this, but of course not limited. Recently we are also having more reports of cats being rabid, biting people, and unfortunately, the people also being infected with rabies. So we need to also gear our campaign around that area. But we know a lot of this occurs through dogs, but cats are also a very good victim. So the challenges around, of course, One Health in action, making sure that we prevent this disease among the canine population, but as I said, not limited. Cats are also a very huge population we need to look at as well. We know cats roam a lot. So knowledge, attitudes, and practices amongst also people that are occupationally there's a occupational hazard to them, veterinarians, para-veterinarians, even clinicians, human medics, right? So availability and affordability is also an issue around the post-exposure prophylaxis. One, rabies is 100% preventable when we vaccinate our animals, dogs and cats. Even when bitten, whether it's a suspected or confirmed case, early presentation, taking the post-exposure prophylaxis documented by WHO. It used to be 5 doses. Now we use 4, right? We use 4, and for prevention, you use 3 doses. But you'll be surprised that even a lot of veterinarians are practicing, have never taken the rabies vaccine. Yes, you can prevent the dog from biting you, but please also get yourself vaccinated. Things occur around scratch and all of that. For me, when I saw the cases in the University of Jos Teaching Hospital, I submitted myself to collect the pre-exposure. It's the same vaccine, but I went immediately and took all the doses because prevention is better than cure. And I'm hoping that people that also in similar scenarios have also done that. I'm not sure if it's compulsory within the veterinary curriculum. As for me, as a student, it was not compulsory for us to take these vaccines. We're not even provided with it. But and I never took it until I went to the field and saw a lot of cases. But it's very important. Students, paramedics, veterinarians, even medical doctors like Medical Doctors Without Borders, Veterinarians Without Borders, please get yourself vaccinated. The cost around these issues, who pays for this, is also an issue. Thankfully now, the World Organization for Animal Health have put out a call, of course, collaborating with other partners to develop strategies to see how countries in Africa and in Asia can be able to access free prophylaxis vaccines and even used for post-exposure as well for rabies. But still, accessibility is still an issue, and this is something that we need to also ensure we can embed in our vaccination programs, especially for people who are occupationally exposed to this disease. So strategies that we need to do, of course, education continuously at the grassroots level. I'm very happy we had that video play out showing us tuberculosis, rabies, and how we need to. So we still need to catch them young, go for campaigns in schools, primary school, secondary school, teach them about rabies. I'm also lucky there is now, I'm very happy in Nigeria, there is a Kick Out Rabies campaign launched by one of our retired veterans in the professions. And trying to see how, there's also a book on that to reach the grassroots level. Be able to communicate through storytelling to change people's perception. So this is very important. I've spoken about issues around vaccination. We need to talk about dog population management. Environment needs to come around this. In Nigeria, I'm not sure we really do anything around stray dogs. We might have very good, fantastic documents, but implementing these, controlling stray dogs is also very key, because people can be vaccinating their pets, but what about the stray dog population? Issues around surveillance as well is very important, and diagnostics, because we need to also find a way to also get point of care diagnostics for rabies. I'm not sure we have that. You still have to, if you want to confirm, you have to take these samples to VOM, and also around the humans, testing for humans is not common, but we don't even want it to get to that stage whereby the person is already has developed symptoms of rabies, photophobia, hydrophobia, and also barking like a dog. We don't even want it to get to that stage. Let us find a way to ensure that the vaccines are readily available, not just waiting for the World Rabies Day, which occurs on the 27th of September of every year. Let's do beyond that. So coordination among stakeholders is one of those things that will help. So just quickly taking a look back at what has happened in the previous years. The theme for the World Zoonosis Day, this year we know it's progress, control, and elimination of zoonotic disease that we have vaccines for, right? Where it's a call for prevention. 2023 was a very interesting one, and I think this rank, even when it comes to the World AMR Day, which has a lot of funding, it was around this World Rabies Day, around this One World, One Health Prevents Zoonosis campaign 2022. Together we can build a rabies-free world, but of course it's beyond rabies, right? It's just using rabies as an example. 2021, we're looking at closing the gaps, reducing the risks. A lot has been done around these areas with the global health security agenda, international health regulations, monitoring and evaluation frameworks. So way forward, of course, we need to continuously do vigilance together across the human, animal, environmental interface. And it's not just related to just these key aspects. We need anthropologists to come on board. We need sociologists to come on board. We need health communications to come on board. We need to look for ways of ensuring that we have the government, policymakers, get them to buy into this. This is affecting our people, the health of our nation. How do we ensure that our surveillance systems are robust across all these systems? Sharing of information, very key. Working across borders as well for zoonotic diseases. These are issues. Diseases doesn't respect borders. And even looking at interconnectability of the world, right? People are traveling around. You know, the number of flights that travel across Europe alone, connecting Europe to Africa, connecting Europe. I know even COVID made us to see. Once there's an outbreak here, before you know, we're talking about the outbreak in Wuhan, China. Before you know, the outbreak was already all over the place in January, and lockdown, boom, everywhere by late January. So it's very, very important. Cross-border issues, cross-border surveillance, quarantine, and all of that. We also need to create access and availability to vaccines. I keep using the example of rabies because that is a clear one, but there are so many other diseases. We need to also bolster research and development for known and unknown zoonotic disease. Now we are talking about highly pathogenic avian influenza, and there are plans as well trying to see. We know the next pandemic is not too far away. Before we had an interval of 100 years. Now with the interconnectability of the world, it's lesser than that. So in conclusion, remembering again what we talked about earlier, the role of the infinitely small in nature is infinitely great. Whether we're talking about microbes or in this aspect, I'm talking about collaboration around One Health. We can be talking about the big guns, human health, animal health, environment. But when we miss out sociologists, anthropologists, the politicians, the people who are going to this, the issues around connecting the town to gown. We are there doing our beautiful researches, but then we are not connecting to people who are going to implement these policies. We, the policymakers, are also writing very beautiful policies, not thinking about how the government is going to, they are thinking about re-election, but how can we also let them know that you need to also protect the health of people that are going to elect you? So it's very, very important. Together, we can shape a healthier world for the well-being of humans and animals in their shared environment. Happy World Zoonosis Day. Thank you for listening. Over to you.
Thank you so much, Dr. Yetunde, for that very insightful delivery. I really, really appreciate you. And I believe everyone here really gotten value for their time. So it is question and answer time. So I would like that if there's anyone here, okay, someone is already raising the office and Dr. Shidrak. So, okay, do you want to talk? Hello, sir. Is it the question already?
Yes.
Okay,
I just
okay.
want to quickly appreciate for the elaborate presentation. There is a lot of learning mentioned. And again, it's a very strong call. So thank you so much for being there. I'm very sure that everyone on the call has gotten immense value. For those that joined at the time when the video has been played already, don't worry, that is still going to be live on our handles and we will share it across with everyone that's visited and across other groups so that we all watch. More importantly, the message that we need to carry, has been clearly emphasized on our products and every little action. So thank you so much for the listening for this. And I think we have something very strongly about it.
Hello, sir. We can't hear you very clearly.
Okay, can you hear me now?
Yes, we can. I believe everyone can hear you.
Now?
Yes. You can go ahead, sir.
Okay, so I was just saying that
I think I'm aware that the Benue Private Veterinarians Association have been on a project where they are driving a lot of awareness about rabies with secondary school students. And if we have the chairperson here, I'm sure he would also will be happy to share the work that they are doing. So I just want to thank you so much. So for now, the floor is open. The presentation was finished, so we'll start with questions. And after that, perhaps we can also share our experiences and the work that we're currently doing in also, I would say kicking out the menace of zoonosis in our time. Thank you so much, Doc, and over to the moderators.
All right, thank you so much for that, sir, Dr. Shedrack. Or do we have any other person that want to ask a question? I have a question from my hand. So if you have a question very quickly, I'd like you to indicate by a raise of hand using your emoji.
I think there are a couple of hands up.
Okay, I think I can see Dr. Nelson. Dr. Nelson alone for now. All right, Dr. Nelson, can we quickly have your question, please?
Okay, thank you very much. I want to also use the opportunity to appreciate Dr. Yetunde for a wonderful presentation. I followed her keenly, and most of the issues she raised are very important. Now, but my concern is always rabies, because I'm a rabies person. And she was talking about rabies priorities in disease surveillance and all that. But in practice, or in the field, we don't see that. After the registered project, anything about rabies went down. We see more of Lassa fever, where people come for deratization and all that. We see some few about TB, but rabies is still underreported. No surveillance activity and all that. And again, aside, as I'm talking to you, I just saw a dog being hit down. Aside other activities, nobody does anything about rabies. You can see the disease, Animal Disease Act 2022 spoke a lot, but is there anybody even trying to enforce or carry out this policy into action? Now, Dr. Yetunde, you are in the NCDC. I don't know. What is it being done about rabies? Because for me, I see more of Lassa fever, which is also a very wonderful idea and a good thing to do because of people are dying of Lassa here and there. The people are also dying of rabies daily. People are being bitten by dogs daily. What are we doing about this? Actually prevent this particular zoonotic disease, in which we're even, let me say, celebrating World Zoonotic Day, and we all started about rabies. What are we doing about this particular disease in practice? Thank you.
Thank you so much, Dr. Nelson, for your question. Also, Dr. Yetunde, would you like to answer immediately now, or you answer together? Hello, Dr. Yetunde, are you there? Hello? Dr. Yetunde, if you are speaking, your mic is mute. Okay. So she wants us to have all the question. All right, so I'll be having Dr. Asuma now. So Dr. Asuma, you can go ahead with your question.
Yes, good morning, everybody on the call. I mean, it's actually not a question, it's just a comment. I mean, I'm actually from the human health aspect, and it's good to see that, I mean, we are all working hard to try and bridge that interface between the animal, environmental, and human health, since it's a very critical point. And I'm happy that we are doing a lot of joint collaboration, and I just want to commend the team and ask that we keep a good work. Thank you very much.
All right, thank you so much for that, Dr. Asuma. So I have a couple of questions here also to ask Dr. Yetunde. I will start my question from the last person that asked the question raised, and that was about rabies. The first question I want to ask now is that, rabies has been a serious global concern over time. So since it's also a zoonotic disease, is there a way, people don't actually know so much about this rabies, even though it's very popular and we all know about it. Is there a way that rabies can be treated after which, looking from our video, after which has been detected that this person, of course, really has rabies? Is there a way it can be treated? Can it even be treated at all? And my next question is that, how can we address the global antimicrobial resistance crisis in the context of zoonotic disease? Is there a way we can address the global antimicrobial resistance crisis in the context of zoonotic disease? And then the next question I want to ask also is that how can we enhance collaboration and communication between animal and human health sectors, especially when it comes to the Fulani herdsmen? How do we communicate to them about this issue? You know, you were recently concerned the other time that there was a point that you were even milk that was taken directly from a cattle, and then the milk was not pasteurized at all. So is there a way, how can we enhance collaboration and communication between animal and human, and majorly looking at the side of the Fulani herdsmen who really do not understand what we are talking about, and then they really need to, you know, understand this thing because they are the one that supply the majority of people with milk and even the cheese that we basically consume. I think that's just all the question I have to ask you for now. Do we have any other person that want to ask a question before she begins to answer? All right. So since we don't have any other questions, so Dr. Yetunde, we can have you now.
Sorry, there's a hand up.
Okay.
Okay. Excuse me, ma. Sorry.
Can I just take this ones first, please? Sorry.
All right.
Because questions are. Thank you so much to everyone for your kind comments and contributions. Really, really appreciate. Even colleagues who have also joined from outside Nigeria. Okay, so with regards to, I think I'll just start with the very first one. There are so many organizations like Vet Connect as well, who are also doing some efforts like around, you know, trying to communicate risks to people at the grassroots level, but the voice is not enough. So a lot of times we focus on social media. Of course, we're in a social media era, TikTok, Instagram, Facebook, this and that. But the real problem is in the field. The people you really want to reach, you know, these Fulani people, they go to areas where there's no even network, right? So now it's left for us. This is a challenge to every one of us as people in this space to design strategies to see how we can communicate to them. A lot of time we are the ones, we're just speaking grammar in the office. That's the truth. We have beautiful policies. I was very happy someone pointed out the issues around the Animal Disease Act 2022 and so many other policies that we have, but we're not doing anything about it. So this will now also link me to the issue around rabies. So in a way, I feel kind of happy. It's a double-edged sword, right? So I'm the national incident manager. Right now, we're not in an outbreak, but as a country, but I'm the lead for the National Lassa Fever Technical Working Group. So I'm happy that you're actually hearing about Lassa fever. But then I'm also, my primary assignment, that's a secondary role. My primary assignment is that I work in the One Health division of the Surveillance and EP department of NCDC. We know we have prioritized this. Currently, we have top 6. Rabies is still number 1. But what we have done is, even though we have the physical space of the secretariat, we have people across, people from agric, environment, and other MDAs who are part of the One Health Secretariat. What we do majorly is coordination. And we know where our mandate is. We can't lead on every disease. We are part of a lot of TWGs as well that are not residents in NCDC. But we know that rabies is 99% dog-mediated. And we also know that that 1% could be through bats, or it could be through cats, or so many other animals in the chain, right? So this is majorly a responsibility of the Federal Ministry of Agri and Food Security. The TWG is there. We also are key partners in that. From time to time, we also put out messages, but maybe it's not as loud as other diseases like Lassa fever, right? and we need to do more. So for me, hearing this feedback, this is also something I'm going to take back. And even when we get alerts from the state level, and I totally agree with you as well. Since the Redese project closed down, it's been grossly, before it was underreported, now it's grossly underreported. Even though I know last year we saw a kind of spike in the reporting, but yes, we know that since Redese closed down and a lot of vets that were engaged were no longer doing all those surveillance activities, it has affected it. I'm hoping that there will be another, now there's pandemic fund and whatever, but there's also issues around sustainability. The Japa syndrome is there. We don't even have enough vets to help. Even the paravets we have is still not enough. So, and even people that are being employed at the federal level, maybe you can say they have a better pay. It's not enough, but a better pay compared to people at the state level. You also have LGAs. Then now you also talk about community volunteers who might be engaged. Then you also maybe leverage on other people that have structures, maybe like Red Cross. So the chain is also issues around. So like projects like Redese have come and gone 5 years. Sustainability is also an issue. Funding is also an issue around this. And even like the way I said that, okay, rabies is number one priority zoonotic disease in Nigeria, but funding is still not enough. After World Rabies Day, all of them go to rest. I am also part of the TWG. Not a lot is being done. We have had a meeting. We had a meeting on rabies last year, December, but since then, nothing has been done. Now we'll wait for World Rabies Day and come again, free rabies vaccination. Then we'll just do 112. Then another thing again, some of the vaccines that are also distributed across our veterinary or even these hospitals for humans, how accessible is it? How aware are people about this? Do you know that for University of Jos, I think there was a year, the teaching hospital, nobody had to pay for a rabies vaccine because there was a year the rabies vaccine from the World Rabies Day campaign was able to sustain. All the dogs that are coming for rabies vaccination got free. They got it free. So, but you know, most of these dogs, even the dog handlers, they wait for that one. Even if that's expired, they wait. All of them are waiting so that you now see a lot of people rushing to vaccinate. But how are we communicating? It's not left alone for the policy people like me in the ministry to work. People like Vet Connect and other MDAs or partners, Red Cross, also need to take this fight forward. So it's a collective effort. Governments can do so much, but then you also realize that there are also a lot of competing priorities. But our voice has to also be loud for it. Then issues around AMR. Of course, AMR is also a zoonosis. If you remember, there was also that campaign around a lot of the antibiotics that is being used is actually in food animals, right? And if we keep doing this, then at the end of the day, you'll be like, oh, I am responsible. I take my malaria drug as I should. I take my antibiotics as I should. But you go and buy milk. You go and buy meat. You buy eggs. They don't even observe withdrawal times. Sometimes they even abuse these drugs that the microbes, normal flora are now resistant. Something as common as Staph aureus are now resistant. So these are issues that are beyond talk, but we need more action. In our own little corridor, how are we talking about this? How are we trying to? AMR has a lot of money, and even AMR as a whole, the money that AMR has can be used to drive One Health to be able to forge or fight for so many things, right? And even as Africans, we need to also do better. We need to stop waiting for people from US or Europe to come and fund our activities here. We also have to be innovative and also look for how to develop our R&D for our own challenges. Like Lassa fever is a West African problem, but it took a while before, global efforts and came into it. And even now, it's not like funding is enough, but at least there are some efforts towards developing a vaccine for Lassa fever now. This in over 55 years. COVID came and before you know, there was a vaccine because what? It was a global problem. And that's why we can never ever, it's very impossible for you to talk about the world as it is now without the changes that COVID made because it was a global problem. So we also have to talk about finding solutions to our own top 6 priorities: zoonotic disease, rabies, highly pathogenic avian influenza. We know that one is global. And Lassa fever is Mpox. and so many other. Bovine TB is there as well. And then even there was a resurgence of anthrax last year, which we haven't had for a while and was not prioritized. But of course, that will also be kept as, okay, we need to keep an eye on this. So the honest truth is that, especially for rabies, the Federal Ministry of Agric and Food Security has to drive a lot of it. As NCDC, we cannot respond to every disease. We will support, even when anthrax came, Federal Ministry of Agric and Food Security has to take that initiative. But then we are also trying to make sure that there is that One Health collaboration. We don't want issues where Agric will be the one doing a press release alone, environment to go and do press release alone, health to go and we want that collaboration. It's difficult. We know the definition of One Health, and we know it's an approach that can help us fight zoonosis. We know they'll keep emerging and re-emerging, but then we need to also come into practice. Also, apart from speaking at the top here in our high horses in Abuja at the state, let's go to the grassroots. Let's go to the local government level. Let's go to the communities. Let's go to the ward. Let's speak to people. Let's interact. Let's make sure that we get their own buy-in. Let them also be able to do positive behavioral changes to carry out things that relate to them, like speaking about the issues around pasteurized milk. It will still shock you to know that more than 80% of the milk we consume in Nigeria is not even from Nigeria. It's imported. All these yogurts that we take, farm fresh, this and that, they have some that maybe the cattle produce there, but a lot of it is powdered milk. So there's still a lot, and there's a lot of opportunities, but then we need to find solutions to our own problem and do this collectively. So I think I've answered most of the questions. Sorry. I hope I have not missed out the ones that were said earlier. So the floor is open for more questions now. Thank you.
Right, thank you so much, Dr. Yetunde. I think I saw someone raising up his hand the other time before you took the questions. All right, also, okay, the person is no longer here again. So talking about the vaccine, you were talking about anti-rabies vaccine the other time that you've been able to access one. So for some of us here who don't know how to, since you are a go-to as far as that is concerned also. So how do we assess the anti-rabies vaccine? I'm not sure it is actually for free now, but then how do we, for someone who wants to take it for prophylaxis, so how do we assess the anti-rabies vaccine, especially for animal health workers?
Yes, so for animal health worker, for me, I can speak from my experience. The honest truth is that this vaccine is not accessible to that extent. Even someone that was working in the veterinary teaching hospital, University of Jos, I could not find this vaccine in our secondary or tertiary or primary healthcare facilities. I went to a private pharmacy. That was where I got it. I paid because I know the risk involved. But what about people, for example, I'm a dog owner, my dog bit 5 or 10 people, including myself, and I'm supposed to take this shot 4 times. How do I get to pay for them? So the only thing I know is that to a certain level, the Federal Ministry of Health has some vaccines, right? And even when we did the World Rabies Day, we also vaccinated. It was a One Health approach we used. We're vaccinating animals and also vaccinating some of the people at risk, that we feel the students, teaching hospital people, wildlife people, just things like that. But it's not enough. That's the honest truth. The only thing now is I know there's this drive, I think through Gavi, and also GAC, if you know GAC, Global Alliance for Rabies Control. You can go there, anybody can sign up, take courses, try and see how you can network within that space. So yes, so the vaccines, they are trying to make free vaccines available, right? Globally, I'm talking about at the tripartite level. And then there's also calls for countries to apply. So it's now for our colleagues, at the Federal Ministry of Health or through the Ministry of Agric and Food Security to help us get this. Of course, there are talks around this area. The person who used to be in the lead for this, the rabies TWG, just retired. So we are yet to get a new person, but of course, these are conversations we also take forward and very good feedbacks for myself as well. But I'm just trying to say that you really have to get them, like, if at your level, these are me, I was talking based on my experience. I know this is a risk for me. I used my money. I wasn't looking for the free one. I wasn't waiting I've seen the case. I've seen firsthand things that have happened, and I won't let myself. But what about people that don't even have the money to get this? That's where the challenge is now. And even when it is available, sometimes it's not accessible. People don't even know. There was a case and we had to be calling, and later they told us, oh, Federal Ministry of Health, there are hospitals. There is a hospital, not even at the primary or secondary or tertiary. There is a hospital in Federal Ministry of Health, a clinic that you can get vaccines there. So you see, the larger public is not available to them. But that's prophylaxis. But for animal vaccines, through the Redese project, I know they distributed vaccines to all the states. So through the states, Ministry of Agri, that's if you go to the Director of Veterinary Services, you can ask them. Some of the teaching hospitals also have from the World Rabies Day campaign. But it's just unfortunate that most times it's that we wait till World Rabies Day. I see that's when puppies are born. Most puppies now that have been born from January, we've even had cases where puppies less than 3 months old are showing signs of rabies. But we know we start vaccinating from our schedules is from 3 months. But now they will keep all those dogs which are exposed, which can be bitten, which can also bite somebody. They'll wait from January to September. Then the other ones that they've been vaccinated last year, they'll wait for World Rabies Day campaign. We need to take the campaign to the doorstep, door to door. That's where we need to take it. But this is just using rabies as an example, right? We know that there are so many other diseases that are zoonosis. This is not World Rabies Day, but we're just using this as an example, and especially for us in Nigeria as a number one priority. These are some of the approaches. These are gaps. These are areas, partnerships we can come into. Vet Connect can also help with this and even help publicize, in so states in partnership with even the Nigerian Veterinary Medical Association, the also Pharmacy Association of Nigeria, Medical Association, nursing, so many. So there's so many areas of collaboration. We know so much about rabies. There was something, I just remember the comments around treating rabies. The honest truth is that personally for me, I am not an advocate for treating rabies. Because when it has gotten to that stage, in the past, we used to say confidently that rabies is 100% death, once life sentence. Once the person has started showing signs, that person is going to die, unfortunately, from rabies. Now, one person has survived in the world, and that's why we are saying 99%. If you check now the current literature and statistics, one person has survived. So we now know that it's not 100%. And that person, supportive therapy was given, blah, blah, blah. But why should we even wait to be treating when we can prevent? When it's 100% preventable. So for me, as a person, I'm not a personal advocate for treating. But if it comes, nothing really can be done other than just supportive therapy. And the people as well, because even in the saliva of the patient, the person will be barking like a dog, scared of water, scared of light. So people even, in a way, like there's also that mental health and psychosocial aspect. They even abandon these patients. You don't want to see where they actually are isolating a suspected or positive rabies case. They leave the person to their own fate. It's really sad, but this is the reality. Because people know how deadly it is also. They don't want to treat these patients, right? So they just leave them to their fate, and it's really so sad. So the honest truth is, people that have, whether it's a scratch or a bite, suspected, take the dose. The vaccine is available, it's just that the price, they will have to pay. But what is the cost of human life to pay? And if it's something that government can also subsidize at the state level, these are things we can do advocacy for, then we can also tell them, okay, if you have a suspected, this government has provided. One very good example is Gombe. Even when Redese closed out, they still have a very strong One Health collaboration around rabies. And they have partners that are funding them. So at the state level, you don't have to wait for national. Please look for partners in the state to collaborate to fight this challenge at your level. Don't wait for federal ministry to do. At the local government level, same way. But then, I know states like Gombe have tried. Other states can also emulate. Don't wait for the once in a life World Rabies Day. And even then, we concentrate on vaccinating dogs. We don't even talk about cats. And then we don't even provide human vaccines. That's the truth. Mostly, it's about trying to eliminate this thing in dogs that we know that 99% are the ones that result to cases. But people can still go to wildlife, go to
a recreational whatever, people that practice bat hunting, people also eat bats. They can also be it can also occur. Bites from bats can also result in rabies. We know that the virus is circulating in the wild. So I think these are my submissions. I hope I have covered every area. There are still more questions. I'm still happy to answer.
Thank you so much. We really appreciate you, Doc. That was really helpful. The first time I was going to take this vaccine also, the price was so enormous. And this is just a call out to every relevant stakeholders also here in this meeting. First Connect is open to collaboration and partnership. So if you actually are in that category or capacity to facilitate the process of assessing this vaccine, very, very important. Please, we would really love to collaborate and partner with you. So very quickly, I would like to have Swem Festus. So, ask his question so that we can wrap up very quickly. So can we have you, Swem?
Okay, thank you very much, the moderator. I want to thank especially Dr. Yetunde for these wonderful presentations and attending to the questions so eloquently. I really appreciate that. I wouldn't be asking a question per se. I would be making a few comments just to address some points that our presenter had made concerning some. Firstly, I would like to.
Hello.
Yeah.
Sorry, before you make your comments, let me quickly ask this other person if she will actually want to ask a question. So after that,
all right then.
Comment. Sorry. So
okay, no problem.
Is that a question or a comment too?
It's a question.
All right. Can we quickly have you?
Yes. Thank you, Dr. Yetunde, for your brilliant presentation. You covered most of the things that are bugging many young veterinarians or people from the health sector, human health sector. But I'd like to find out, we are quite aware of the priority zoonotic disease, especially those that affect Nigeria: tuberculosis, avian influenza, E. coli, AMR, and those other things. But I'd like to ask, as someone from the animal health sector, how do you position yourself for international funding? I know you said we shouldn't always wait for funders to come from out of the countries to help us with diseases. But if you look at the human health sector, you see that they have several funding, unsolicited funding from funders that just come and sort of beg them to take funding. And this shows in the way they attack diseases, in the way they advocate, in their capacity trainings and a lot of that. So as someone that constantly sees, I for one, I'm a surveillance officer within the abattoir. We see several cases of TB, bovine TB, brucellosis, and these are things that spill over into the human population. So how do you position yourself for international funding in the fight against zoonotic disease in Nigeria? Thank you.
Thank you so much, Dr. Sherifat. Really a pleasure to have you comment, my amiable colleague. So, speaking in a way, like I think I will have to say something. So, I know there's a lot of funding in the human health sector when you want to compare it now to what you have in animal health or environment. And this is a global issue. We as human beings, are you telling me as a human being, sometimes you first of all consider yourself before you even think about your animal or your environment. It's you first. Even when you are in the plane, they talk about putting your own mask first for oxygen in case of any emergency before putting even for your child, because you need to save yourself first. But notwithstanding, this is where the One Health approach has come to play. And I'll also speak from my experience as an expert in this area. Unfortunately, sometimes as well, this is based on interest, right? But sometimes even when the human health want to help, whether environment or agric, right, to see areas of this thing, sometimes they also take it as you want to come and take over. I'm also speaking as a vet. I'm a vet, and I'm also working largely in the Ministry of Health. So I'm seeing both angles, and I also work with the environment, right? Now, talking about sourcing for funding, you as a person,
there are so many grants, so many funding that you can access. And also just a bit as well, the funding we have in the human health is not limited, or generally globally, right? It's not limited. But you also realize that we also complain about funding. Funding is never enough, right? And some of these might seem like unsolicited, but actually we are actually soliciting for this. They're actually looking for areas of collaboration. So the first thing first, I'll advise anyone at the Ministry of Agric and other people is, how are you open to collaborating? That's one. Because I've always heard this thing, and I've heard people say it a lot. One Health is a veterinary, this thing, we don't know why these are. One Health does not belong to anybody globally. A lot of vets, yes, are driving it, right? We are celebrating World Zoonosis Day. Louis Pasteur is a virologist and a chemist. So he was not even a veterinary doctor. And today we are celebrating him as a, and we've also had medical doctors who has made stride. Nobody owns One Health. One Health is an approach. So we need to realize that, and we need to also begin to position ourselves rightly. Because you can be saying, it's so sad. I went recently for an inauguration of a TWG. It was done under the Federal Ministry of Health, and it has to do with food security, and they added feed safety. I've never seen where humans are talking about feed. Feed is an agric sector specific thing. But because we in that field are not doing what we need to do, we are not publishing, we're not putting ourselves out there, we're not open for collaborations, grants, proposals will come, we will not write. They'll reach out to us, we will not respond. Our profiles are not out there showing we are doing, and we are open. Now, when this clearly work with them and are open, so they seems to be as if it's skewed towards one side, as frozen, and I've been able to unmute myself. That's why I'm using my phone. So it's now looking like it's skewed, but we on this end, are we doing enough? And even as it's going now, there's even so much money that is coming to environment that we are not even looking at. So One Health is an approach. It doesn't belong to anybody. And the sky is open, just like the way the birds can fly freely. It's open for everybody. It's just, how are you able to get this funding? How are you positioning yourself? Money will come, but we shouldn't put money first. Now you're talking about this data of you experience this and that. Please, is this data available online? Did you publish it? Have you done a research at the abattoir level? From your epidemiological reports, of course, with proper permission from your bosses. Rather, we send data to ARIS, Abi, and WAHIS. We dump it there. We don't use it for anything. How are you using it for policy making? Are you talking? Are you speaking? Now, let me also give examples, around issues within the, maybe it might not necessarily, I'm not poking any ministries specifically, but just giving an example. Now, as a young person, you might be like, after this webinar now, you have this idea, you put up a proposal. You also need the buy-in of your boss, right? Or sometimes, unfortunately, you are there in your division. You might not really be in public health, maybe as you said, abattoir now, right? I'm just giving an example. I don't know what department that is. You maybe write a grant proposal and you get funding. Now you tell them, because you also need your institutional support, and they'll say, no, you can't implement this project. Your level is not, it's level this and that. They remove you from it. You are the brain behind it. These are issues that also need to be dealt with. So from the beginning, as a young person or a mid-career professional, try to involve your boss. Tell them this proposal. Put them in. Carry them along. You know the money is there. It will come, right? But carry them along. Let them be part of the process. So that when you now get it, they'll not now say, no, you can't handle this project. They will remove you. Or as a senior person, foster environments for collaboration, an environment for young people who have these ideas, who have this energy. You as an older person might have lost this team. Create that enabling environment for them. So I'm just trying to bring out different angles that it might look like we have unsolicited funding. They're coming to us. It might look like the money is a lot. Seriously, we don't even have enough money. And there is money for other sectors, but people are not doing as they should. So they rather come to people that they feel have capacity, or at least have demonstrated for some form of capacity. Whatever it is, the little thing that you have in your decks, Start compiling those reports. Start making analysis. Start working on them. Use simple epidemiological tools like Excel. There are so many other advanced ones. Use it. Prepare. Say, this is an issue we think we should pay attention to. So if they are funding around One Health, design something around that. Take samples of people, abattoir workers, veterinarians. Take the sample of the animals before they are slaughtered. There is a lot. So I think I'll just stop here, just not to overflog the issue. So over to you, moderator.
Thank you so much, Dr. Yetunde. That was very great. Mr. Swem, right? So could you please briefly take the comment so that we can get on time?
Okay, thank you so much for the opportunity again. What I was going to say firstly was about the pre-exposure vaccination for practitioners who oftentimes are potentially at risk of being exposed to rabies. When I was a student in vet school, we were lucky at that time to have a very proactive and energetic director of the veterinary teaching hospital at that time, in person of Professor Yedipe, and also the student body also made a case on the issue of pre-exposure vaccination for students, clinical students, particularly at that time. And the university administration honored that. It was brought in by the director, and the director energetically pursued it, took it up with the administration that is their responsibility to vaccinate not just the students, the clinical students that were going to be exposed to handling dogs, but also the clinicians that were in the veterinary teaching hospital, and every other vet that was on call in the teaching hospital at that time was vaccinated. So we all got the 3 shots of that vaccine at that time for free, and it really helped. And within that period, while we were in vet school, we had cases of students being bitten by dogs. Luckily, those that were already vaccinated, and they were still recommended for vaccination anyway, and even clinicians. So it brought out the relevance of that pre-exposure vaccination much more, and I think that was done for about 3 sets that came after, and that was all. And it is no longer in operation at the moment. I am now a staff in the same university. I'm a clinician in the teaching hospital. I am on call in the teaching hospital, but nobody takes that pre-exposure again. I believe even the ones that are there have not taken it because of I think availability and the cost, just as the presenter has said. My worry is,
okay,
if then
I would like you to quickly make your delivery, Dr. Swem.
Okay, if then that was possible, I'm wondering why it is very difficult now. It looks as though things are getting worse and more deteriorated than it was back then, and it's actually a cause of worry. I don't know why such a practice should be dropped anyway. But just to say that if there's any way our leaders can also continue to make this case in those establishments for students and also for the clinicians that are there to be given this pre-exposure, it will be really, really important. The second thing I want to also make point about is the issue of our abattoirs. Our abattoirs are really a source of concern, particularly for us here in Benue State. We have very deplorable conditions of the abattoirs, and it's a cause of worry. Just recently, when we celebrated the World Tuberculosis Day, on that very day, we went to the abattoir for sensitization, and we discovered several classical cases of TB.
All right, Dr. Swem, I'm not sure we can hear you again. Dr. Nelson, please, if that is a question, you'll be the last person to be taking a question from today. So quickly ask your question, sir.
It's still an issue. As a person, I tried to, do something to also help. Hello, can you hear me?
We lost you at a point. So I think, Dr.
Okay.
Just quickly wrap up, Dr. Swem, so that Dr. Nelson can ask his question.
Yes, wrapping up now. And so I also try to, we try to do some private advocacy on the importance of the cleanliness of the abattoir and the hygiene and all of that. And we also tried to set up an establishment where meat can be processed, particularly for now, chicken meat, so that it will be more hygiene, looking at the very terrible condition of the open market, and to help reduce the burden of this public health concern, so that it will safeguard the health of humans, those that are consuming the meat. But it has been an issue, as several cases have been made with the government, but you discover that they don't pay attention to it at all. It's actually a concern, and we hope that a time will come where the people in the power will be able to pay attention to these things, and they will get the needed attention. Thank you.
Thank you so much, Dr. Swem. So, Dr. Nelson, is it a question?
Okay, mine is actually a question, just a call to action to encourage us all. The Association of Private Veterinary Medical Practitioners of Benue State, in preparation for this today's World Zoonotic Day, organized an awareness where we visited over 10 schools, 3 senatorial zones of Benue State. I want to reach out to approximately more than 5,000 school children, just like Dr. Shedra was saying earlier. I also want to appreciate Dr. Shedra of Vet Connect, because their collaboration with Sika this initiative and War Against It actually made this a success. So I'm still calling up on all you. Let's come together. Preventing zoonosis and safeguarding not just children or ourselves to our top priority. Just like the prevent Dr. it should be a priority to collaborate. We shouldn't wait on the government. We shouldn't wait on maybe the state, federal, or whatever funding from abroad. We can do this ourselves and safeguard our future. Whatever it is, our health is in our hands. Our protection all lies in our hands. So let's come together as one. We, in the Association of Private Veterinary Medical Practitioners, Benue State chapter, we are open for collaboration for more of this intervention. Thank you very much.
All right. Thank you so much, Dr. Nelson. Dr. Yetunde, we'd like you to give a very closing remark so that we can conclude the webinar for today.
All right. Thank you so much, everyone. Thank you so much for your active engagement. Thank you to our wonderful moderator, Dr. Shedrak, the team at Vet Connect for putting up this wonderful series. It's really a great pleasure to be here. Colleagues, happy World Zoonosis Day once again. This is a call for us to continue to raise awareness on zoonotic diseases and everything around that space using the One Health approach. It's also a call for us to realize that at whatever level we think we are, we have something to offer. Whether you're a student, there are campaigns you can run, there are avenues you can create. This is how you start building your skills and preparing for the global stage. Whether you are at this local government level, you're a para-veterinarian, you're a community member, a family member, you can safeguard your health, protect the health of your fellow colleagues as well through something as simple as hand hygiene. It begins with you. And of course, you have a larger community and generation ahead for us to also protect and safeguard their health. But then at whatever level it is, you can always bring something to the table. We don't have to look at the bigger issues around funding. These things will definitely come if we consistently remain focused on the issue around our collective efforts, seeing how we can sustain, especially even just speaking with just rabies in mind. There are so many others, but I think rabies is the one that is easy to relate with, and that's why we keep going back to it. It's our collective effort that is needed. We need to use a community-centered approach. We need to get the community involved as well. We need to mobilize people, let this awareness about zoonotic disease and the fact that we know that 60% of zoonotic diseases, diseases of humans are actually zoonotic in origin, were from animals, and more, the emerging and re-emerging ones are still from animals. But let's see how we can also be able to collaborate at whatever level, whether you're a student, even if you're at secondary school level, whether you're an undergraduate, a graduate, you're working at the local government or a state level or national or federal, or even you are even an international person, probably working with WHO and the likes, whatever level, let's always remember that the goal is to safeguard the health of humans, animals, and the planet. This is, for me, I feel this is just the best way to end it. It was very, very good, the video, very helpful. So the team behind this, immense gratitude to everyone's efforts to see that we have this awareness created. It's not stopping here. Please take up a lot of the recommendations and actions. Feel free to reach out to me through Vet Connect or even personally if you know me and you need, I might not have, I don't have the money. I don't have the money you're looking for, but at least I could be able to share resources that can guide you in the right direction. So please feel free. We are all in this together. It's not something that only one person can do. Together we can achieve and make the world a safer and a healthier place for all. Thank you and bye for now. Bye and see you very soon.
Thank you so much, Dr. Yetunde.
Enjoy the rest of your weekend. Bye-bye.
Thank you so much.
Colleagues.
Thank you so much for the time, and we really appreciate you. We are honored and then we are privileged to have you on the webinar today. And I believe everyone, as much as I am, is glad to have you here. So I don't know if Dr. Chidrak has one thing or the other to say before we
yes,
play the video
okay.
for those that did it.
Okay. Apologies, I had to drop off a clip, but to even come back and see that I was thinking where the Q&A was happening. I was trying to start then. And it is impressive that, more persons, a lot of conversations have gone through this process. I think this is the start of something which is going to get more interesting. I'm a practitioner of what we call strategic doing. And what we do is about saying that learning can be applied. So one of the things I say, when I'm talking to my team about Vet Connect, we must do a solution that is driven on the ideology of open source. And what this means is that we are not custodians of knowledge to say that, we must be us or no one else. We must always give room and give an opportunity for everyone to be able to continue. And we want to keep learning and evolving through this journey. And I want to thank all of you so much for, putting your time on the line to be here today. They were thinking they will play the video again, but I think we'll share that after the call. It's going to be available on our handles and so when you please watch, do well to like, do well to subscribe, do well to leave a comment. And for veterinarians or paraprofessionals on the call, we want to encourage you again, please sign up on Vet Connect. You are able to find, aside from the connectivity provided, you are able to take control of your data, especially for those of us who are mobile veterinarians and currently don't have physical premises, your data is yours. It's important that we do not lose it. We have built a platform for you to be able to retain all of that and then also collaborate. We have over 7 African countries with colleagues across these regions that have actively signed up there, and we are growing. So we are building a very, very inclusive ecosystem that will be able to sustain and give us all of the things that we need. If confronting our problems, remember we cannot solve it with the same level of thinking that created it, and that's why we're thinking it's not higher. So thank you so much, and we look forward to our next webinar. But Dr. Yusuf, thank you. I know that when we call it again, you will turn up. Thank you so much for that.
Dr. Shedrack.
Yes, by team, I want to thank you all so much for sparing time to be here. Have a wonderful weekend, and may the rest of the year be very kind for over.
Right. Thank you so much, sir, for that.
Really great collaboration. Looking forward to more. Bye.
Yeah, thank you so much, Dr. Yetunde. And thank you so much for everyone that joined the webinar today. We really appreciate you, and indeed we celebrate you. So you can sign up on Vet Connect as a veterinarian or veterinary paraprofessional here. And then the link to do that is www.vetconnect.com. And then you can follow us on our social media pages to know more about us and then to ask any question you feel like asking us. Thank you so much. I really appreciate your presence.
I think I was actually going to ask. So for people like us that have dropped our syringes, is there still need to sign up?
There's definitely a place for you, Doc.
Because that's why I did not sign up. Oh, I'm already confessing now. Because I'm not using syringe to make change again. Huh? I carry my pen and paper.
By all means, the connectivity in itself is already something that you want to also be a part of. So there are a lot of use cases I assure you it's going to keep evolving, because the question was, is this just for those of us in practice?
Yes, that's why I never signed up. So maybe you need to do campaign around that area for people like me.
Absolutely.
I never signed up because I was like, nah. Someone will now call me and say, I have a dog. I don't carry syringe again. All right, good to know that it's evolving and there's space for people like me.
All right,
so thank you.
Looking forward to having you very soon, ma'am. Thank you so much.
Yes, I'll sign up.
All right. So goodbye to everyone and happy Zoonosis Day.
What about this?